Hello. Hello.
Hello.
Hello. Good morning. Hi, Jyoti. Sharon. Yeah. It
Good
was just
morning,
my
Sharon.
sound check.
Yeah.
Okay. So all good, no? Chalo.
बोट बोली ना बोट से है
ये अपने शोधते वोट वोट
Good morning, everyone. क्या हुआ? बोला कि कार्डियक मोड से सीखना है।
I request participants to please mute yourself. Revati ma'am.
Good morning.
Good morning, ma'am. Sorry, I was unable to unmute. Thank you for joining, ma'am. Uh, Good morning to all participants, and good morning, Sharon ma'am. Thank you for joining us. Dr. Supal ma'am has also joined us. Thank you so much, ma'am, for joining. We are waiting for the participants to join.
Good morning, ma'am. Good morning,
Good
Jyoti.
morning.
Good morning,
Good morning.
Jyoti, ma'am.
Good morning, ma'am.
Two Jyotis today.
Yeah. Good morning, Dr. Supal. Good morning.
ma'am. Good morning, Sharon. Good morning.
morning.
Good morning, everyone.
Morning, everyone.
Ma'am, with your permission, shall we start? Then let the participants join. It is 10 o'clock.
Good morning to all the esteemed delegates, distinguished guests, and our eminent national as well as international speakers. I, Manjeet Kaur, feeling immense pleasure to welcome all of you on the occasion of International Webinar on Simulation and Nursing Curriculum. This webinar is organized by College of Nursing, GMCH, in collaboration with Nursing Scholar Society. as today's event is under the aegis of Nursing Scholar Society, we have with us our National President of NSS, Professor Dr. Beenu Joy. I welcome you, sir. Firstly, we have our chief guest of honor who doesn't require any formal introduction, as you all must have heard about her deeds, endeavors, and endless contributions towards profession. So on behalf of one and all present here, let me extend a warm welcome to our dearest madam, Professor Dr. Jyoti Sareen, Dean Faculty, College of Nursing, Maulana Ambala. Ma'am is a very respectable personality who is widely known to put a lot of efforts in the area of neonatal care and even as a president of IIN. I welcome you, ma'am.
Thank you.
Another noted personality in our profession throughout the country is our respectable madam, Dr. Sukhpal Kaur. Madam is presently academic head in the 9 PGI MER Chandigarh and also our NSS chapter advisor. Ma'am is renowned for her dynamic research contributions with hundreds of papers and citations. I welcome you, ma'am. I feel it is needless to say something about the importance and value of today's for all of us. The glittering and enthusiastic to learn faces tell that already. I thank all of you for turning out in such a great number in short time and level of interest shown by the number of registrations we received in encouraging as well as already attest to the importance of the topic which we have gathered to discuss today. I welcome our international speakers, Madam Sharon Mascarenhas, as well as our national speakers also. So now, last but not the least, I extend my hearty welcome to our beloved and respected principal and NSS chapter president, Madam Professor Jyoti Katwal. I welcome you, ma'am, and I invite ma'am to introduce the professor to give overview regarding this webinar.
Thank you so much, Manjeet ma'am, and I welcome all the delegates and the speakers. I think Manjeet ma'am was not knowing the names of the speakers. That's why she missed Dr. Anand Grover and Dr. Manjubala Dash. Welcome, ma'am, and thank you for this support that you agreed for taking these sessions with us. Coming to the
Thank
overview
you.
of
Good morning. Good morning,
morning,
all.
ma'am.
Thank you.
Thank you, ma'am. Coming to the overview, simulation-based nursing education is any educational activity that utilizes simulation. And it can be a standardized patient or it can be a mannequin where we replicate the clinical scenarios. Although it is said to be a new paradigm in nursing education, but we have all been using it in our own personalized manner. With mandation of new curriculum, simulation-based teaching expertise is needed. Therefore, we all got trained from National Simulation Center, and our motive is to spread the knowledge and skill. Hence, we have organized this webinar to apprise the nursing faculty about simulation. And our next step is to organize a workshop to gain expertise on how to implement it when we are teaching the students. Simulation tools serve as an alternative to real situations. Thus, it is not compulsory to have a high fidelity mannequin to have simulation-based teaching. In simulation, we are teaching or training the students about the skill implementation and how to make clinical decision making. As clinical scenarios are different from demonstration that we do in labs. So in simulation, trainee can make mistakes and they can learn from their mistakes without being fearful of making mistakes in the real scenario. So on today's webinar, all of us will learn about basics of simulation and its implementation. Hope to meet you all in the workshop as well. Taking this opportunity, now I would like to introduce our chief guest of honor, Dr. Jyoti Sareen. Madam is a mentor also for me, and within short period of time, we have gained a lot of closeness with each other. Without wasting much of time, I would like to introduce our beloved Dr. Jyoti Sareen. Madam is Dean Faculty of Nursing and Director of Principal of College of Nursing, MMGU Maulana Ambala. Looking onto the experience, ma'am has vast experience of 36 years Madam is graduate and postgraduate in pediatric nursing and a PhD holder from RAK College of Nursing in 2005. Madam has significantly published papers and not only a participant of state and national level workshops and conferences, Madam even have represented India in international level as well. Madam is a member, core member of Developmental Society Quality Assurance Model from WHO. Madam has participated in international practical training course in quality assurance from Indonesia and SIDA program in child survival at Sweden. Madam is president for Indian Association of Neonatal Nurses, certified national trainer for neonatal resuscitation program. Madam is national trainer for integrated management of neonatal and childhood illness and virtual capacity building program for midwifery faculty organized by INC and UNFPA. Though ma'am's achievements are endless, but I have delineated few of them. Madam has been awarded with President of India Silver Medal for Academic Excellence in BSc Honours Nursing, President of India Gold Medal for Masters of Nursing. Madam has also been awarded with TK Adrinwala Prize for Best Work Done in Research in Masters Nursing Dissertation. I welcome you, ma'am. And ma'am, if you could speak to our participants and address them.
Good morning, everyone. It's indeed a delight to see that how well Nursing Scholar Society is taking the lead to organize and take initiative for conducting various webinars for our nurse educators. So kudos to Dr. Sukhpal and her entire team. I'm really impressed with your initiatives. Dignitaries on the dais, eminent nursing leaders and educationists across the country. At the outset, I extend my gratitude to the organizers for having me on this platform. I would like to appreciate and acknowledge the efforts of GMCH College of Nursing under the aegis of Nursing Scholar Society, Saffron chapter, to organize international webinar on simulation in nursing curriculum. As rightly said by Jyoti Kathwal, that this is the need of the hour, and I agree with her that this is an evolving science. This is an attempt which has been used by our teachers since when we studied way back in 1980s. And it is only the creativity of the teacher which can make it more applicable and effective for our students. So we know that over the last decades, it has become apparent that there is a need for understanding of factors contributing to educational efficiency and the process of implementing scientific evidences into practice. With advancing technology, nursing education also must evolve. An increasing focus is there on quality, higher equity, safety, specialized and complex clinical practice further emphasize the need of incorporating innovative and experiential learning styles for our students. We all know and agree with it that there is wide heterogeneity of providing clinical experience across the country. And it has been seen that now the clinical experience which has been provided to our nursing students in the complex situations is becoming more observational in nature. So this all the more gives a call to have simulation been incorporated into the nursing curriculum, and INC has taken initiative to incorporate it. Now it is our responsibility to how to implement it in an effective manner. And I think this is an attempt to make it more organized, more structured for our nurse educators. And we are oriented with the present challenges of nursing education, and to some extent these challenges we can overcome by integrating simulation into the nursing curriculum. All of us know that simulation is an advanced educational pedagogy used to replace or amplify real world experience with guided experience in an attractive manner. Simulation provides opportunity for repetition to facilitate from becoming novice to experts, making conceptual connections to promote clinical decision making and critical thinking. It further allows students to make mistakes in controlled environment. And I always feel that we learn best when we make mistake in a safe environment, and we can also learn from our mistakes. And this also provides an opportunity where the specific diseases and scenarios which are rare in nature, like end-of-life care, intubation, disaster management, interdisciplinary communication, can be well handled by using simulation in nursing education. So there is a need to redesign the clinical teaching model to include simulation to enhance quality of education. Various strategies across the globe have been implemented to augment the traditional clinical model. When simulation is integrated with clinical placements, students practice key clinical behavior and concepts in a safe environment, which encourages transferability of learning to actual care situation in clinical practice. So what do we want? We want our students to develop and have a trustworthy experience with our patients. And this can happen only when they are able to provide confidently comprehensive holistic care to the patients. And for having that, it means they need to have confidence for dealing with those situations. And this can be done better in a controlled environment before they are exposed to real world context. And once I say controlled environment, the beauty of it, the challenge lies in front of nurse educator is that how well we can redesign these scenarios as close as to the real world context. So without taking much time, there are certain thoughts which I would like to convey here is way forward that I think all of us as nurse educators need to further explore what are the situations where the simulation is more appropriate, which simulators to be used in which scenario, how well the scenarios can be structured, and how well we can design a standardized approach to simulated learning in nursing education, and what percentage of clinical hours can be substituted by simulated learning. Considering all these points, in our college, we have taken up 10 research projects with our undergraduate students as well as with our nursing faculty. And certain projects have been taken up in collaboration with University of Norway, where we are trying to explore this and try to answer these questions, and so that these can be forwarded to the policymakers, and accordingly the redesigning of simulation and integration of simulation in the nursing curriculum can be facilitated. So wish you all the best, and I'm very hopeful all the deliberations in today's proceedings are going to be very thought-provoking, and it will be a great learning academic feast for our participants, and wish you all the best. And thank you again, organizers, for having me here.
Thank you so much, ma'am, for enlightening us regarding the integration of simulation into the nursing curriculum. Thank you so much again.
Most welcome.
Thank you. Moving ahead with our itinerary. Now I would like to introduce our next eminent personality of nursing fraternity, Dr. Sukhpal Kaur. Madam is a known academician in our nursing field. Coming to the ma'am is all, as we have already mentioned, ma'am is nowadays academic head of 9 PGIMER, and ma'am's education, when we look on, madam has done her post-graduation from PGIMER in 1995 and PhD from PGIMER in 2002. Madam has done a certificate course in Essentials of Palliative Care and post-graduate diploma in statistics as well. Madam has done enormous work in research. Madam has done funded research projects that are 16 funded from ICMR, DST, and DBT. Where Madam has done paper presentation not only at local and national level but at the international level as well. Madam has also given guest keynotes on different platforms and has been invited as a guest faculty on a number of conferences and workshops. Madam has done publications around 180 and count is still going on. And Madam has contributed many chapters. Looking onto the number, there are many, but enlisted are here 37, edited books are 8, and written patient education booklets are 21. Madam has written books related to nursing research, geriatric care, oncology and palliative care, chronic illness, and women's health. Madam's field of interest is nursing research, geriatric care, oncology and palliative care, chronic illnesses, and women's health. Madam has vast experience of 28 years. Madam is life member of 12 scientific bodies. Madam is member of editorial board of various national and international journals. Madam is Countess Secretary and Vice President of Nursing Research Forum, and also chapter. I welcome you, ma'am, and I will request you to invite our participants with you.
Thank you so much, Jyoti, for the kind introduction. And a very good morning to all of you, respected Dr. Jyoti Sri, Dean, Faculty of Nursing, MM Haryana, and Chief Guest of the Day, Dr. Jyoti Khatwal, President NSS Saffron Chapter and Principal GMCH College of Nursing, dear national and international faculty of the webinar. I'm really very, very honored to be part of this international webinar on simulation in nursing curriculum under the aegis of NSS Saffron Chapter. We know that simulation as such, it's not something new in nursing, though with the advancement over the period of time, many parameters in simulation-based teaching learning have been added. Like initially, we didn't have the very, very high fidelity mannequins with us. However, now we have more provisions of very high fidelity in many of the institutions. We have medium high fidelity mannequins. We can make use of the standardized patients. Actually, all these things we learned when we went to Dr. Anu Grover at SDT Gurgaon. I think ours was the first batch. Anu, you must be remembering that. That was really a great honor. Yeah, it was really a great honor for us that we were the first batch to get trained, and it was really a great learning experience for all of us. We will never remember that. And we know that once something happened for the first time, that's really, it makes a lot of impact on your mind. We had learned not many things, and we started a bit in our institutions, but because of the government institutions, we have a number of constraints of not getting the funds. We are trying our level best to get good mannequins. However, whatever things are available with us, we are trying our level best to implement or to make use of those. We have medium fidelity mannequins. We have started making use of the standardized patients. Initially, we were not much aware of that. Skills stations, definitely we were aware, and we are practicing that. We are preparing many of the scenarios. And in fact, the concept of simulation-based teaching, it has taken more momentum during the COVID-19 pandemic. Otherwise, our institution, it's a tertiary care institutions, we have the open books, the patients are available with us. But we had a lot of constraints during COVID-19, and we had also the pressure that we need to complete our syllabus within time. We need to conduct all the exams, within the stipulated period of time. So during those days, the simulation-based teaching, it has taken a lot of momentum, and definitely a lot of learning took place. How to handle the situation, how to handle the crisis situation. It was really, and because we were trained from SDT, it was really a great help for all of us. So simulation as an educational process, it can replicate clinical practice in a safe environment. And apart from teaching the students in crisis situation, it is very good method of teaching, especially for the novice practitioners, in order to develop their skills before they start practicing on the patients in the real situation. And there are a number of studies, a lot of literature available, wherein it has been reported that the nursing students who take part in educational programs involving simulation, they perform less mistakes in clinical settings. They are better able to develop their clinical thinkings and clinical decision-making skills. So it's very important. And actually, we are practicing this also, especially for the first year BSc. Initial 3 to 4 months, they are in the labs because they're altogether new students, altogether new to this profession. So we try our level best to make them little bit friendly with the various basic procedures before they start going in the clinical settings. And the results are quite good. So simulations, they offer a chance to experience real life scenarios that depict the true events. And the importance of simulation and a lot of other things, they have already been taught by Professor Jyoti Sreen. I would not like to repeat the things. So various simulation tools, they serve as an alternative to real patients, and a trainee can make mistakes very well once we are working on the simulation based teaching, but we just cannot afford making the mistakes once we are working with the patients. So because only just a few people have been trained by SDT, lot of new things are to be learned by our nurse educators. So it's very important that we organize such type of workshops more frequently so that everyone get well versed of all the new technological based educations and new things which are coming up in the education. And we should try our level best to take up this profession to the heights as far as possible. So I'm sure all the participants of the webinar, they are going to have a great learning experience after undergoing such a beautiful chalked out programs of the webinar. Thank you very much once again for having me here and to be part of this program. Thank you so much.
Thank you so much, ma'am. Yes, it is very truly said by ma'am that due to the COVID pandemic, everybody has emphasized and started practicing this simulation. And now they are knowing about the importance of simulation in nursing curriculum also. Thank you so much, ma'am. And now I invite Madam Ramandeep Kaur, Assistant Lecturer and Treasurer of NSS, to propose vote of thanks. Handing over to you, ma'am.
Good morning, everyone. I feel an immense pleasure to propose a vote of thanks on behalf of NSS team and College of Nursing. At first, I would like to thank our notable chief guest, Dr. Jyoti Sreen, Dean Faculty, MMF College of Nursing. Ma'am is a well-recognized personality in our society, in our profession. Ma'am, your teaching has gone beyond the classrooms. So we are very thankful to you, ma'am, for accepting our invitation and sparing time from your hectic schedule. Once again, thank you, ma'am. Secondly,
Always a delight.
welcome. Secondly, I would like to express my gratitude towards Dr. Sukhpal Kaur, NSS Chapter Advisor and Academic Head PGI MER Chandigarh. Ma'am has never said no to us. Ma'am has always provided limitless support to us. Ma'am, your encouraging words always inspires us. You are like a source of motivation to all the faculty of College of Nursing. Thank you so much, ma'am, for accepting our invitation.
Thank you so much. It's my pleasure. और बहुत कुछ बोल दिया ऐसा नहीं हूँ. I'm nothing.
नहीं मैम ऐसा ही है हम लोग कभी भी पहुंच जाते हैं आपके पास and you are always receptive क्या है.
It's my pleasure to be associated with such a learned faculty. Thank you so much. Thank you.
Next, I would like to express my gratitude towards NSS team, our Professor Dr. Jaswinder Kaur, Director Principal GMCH, for their encouragement and always they provide support to us. Next, my heartfelt thanks to Professor Jyoti, Principal College of Nursing GMCH, who has left no stone unturned to push the college to new heights. Ma'am, you always inspire us. I owe a gratitude towards our worthy speakers, Madam Mrs. Sharon Maskaran, Dr. Anu Grover, Officiating Director NRS Gurugram, and Professor Dr. Manju Baladash, HOD OBG Mother Teresa Postgraduate Institute, Odisha. We all are very grateful to all our speakers for accepting our invitation. Without you all, our event can't be successful. So we are very grateful to you all. Next, at the last, I would like to thank all our participants who are present here. You are all are an integral part of this program. Once again, I thank you all for joining us. So with this, we are ending up with our inaugural session. So now it's the time for pre-test. So pre-test link we are going to share with you in the chat box. So you all will be given 10 minutes. Within the 10 minutes, you have to finish the pre-test. Pre-test link is shared with you all. Kindly fill it in the stipulated time.
Nimen small baby na. Tabo amar first. Idu last. नहीं नहीं प्री टेस्ट चल रहा है लिंक नहीं आया आपके पास? मैं शेयर करती हूँ अभी।
Shweta ma'am, please mute yourself.
Oh, सॉरी।
So now we are starting with our session. So our first speaker is Mrs. Sharon Mascaron. Ma'am is an international speaker. Ma'am is a senior simulator educator and lecturer at Mohammed bin Rashid University of Medical and Health Sciences, Dubai. We are very lucky to have an international speaker among us. A background about ma'am. Ma'am has done her MSc in 2007 from SNDT University, Mumbai. BSc Nursing in 2002 from Rajiv Gandhi University of Health Sciences. Ma'am has a rich experience of simulation modality as a task trainer, 25%, mannequin-based 35%, simulated patient 35%, and computer-based 10%. Ma'am has designed various simulation-based education and skill training curriculum for nursing, dental, and medical sciences, such as design and deliver simulation-based learning experience and course for postgraduate nursing student at MBRU Dubai University, design and deliver simulation-based learning experiences for postgraduate nursing student, postgraduate dental resident, and undergraduate medical student at MBRU Dubai University. Work in collaboration with faculty to facilitate simulation for undergraduate medical students from Dubai Medical University. Design and facilitate simulation-based infection prevention and control program for dental assistant and dental hygienist for Dubai Dental Hospital. Design, coordinates, and deliver faculty development session simulation design, debriefing, and delivery. Ma'am has done various certificate courses such as Pediatric Simulation Fellowship with IPSS and Inspire, CHSE from Society of Simulation in Healthcare, ESME Certificate in Medical Education for AME, and BLS training from American Heart Association. I welcome you, ma'am. Kindly address our audience.
Thank you so much. I hope I am audible.
Yes, ma'am.
Yes. Okay. So first and foremost, I want to thank everyone over here for having me on this platform. Thank you, Dr. Jyoti Sareen, Dr. Supal Kaur, for your very, very inspiring words. When I was listening to you, I felt that maybe somewhere in my nursing career, I missed out on your interaction, you know, when I was in India, because everyone was speaking so lovingly about all of you. And I really felt that truly in my heart. Thank you, Professor Jyoti Katwal. She's a friend. She has been a colleague during my MSc, and she had a very integral part to play when I was in Mumbai with her. I think we supported each other in more ways than one, and I take great pride that we still keep in touch on a regular basis. Thank you so much to my fellow speakers and the hosting team, and most importantly, the participants who are giving us your time to listen to this session today on simulation. So if you see my background, I am a nurse by profession, yes, but I have diverted a lot into simulation-based education, and I have specialized in simulation-based education. And before I start the presentation, I want to say that if any of you out there in the faculty or in the presenting board, you'll want to specialize at some part at an international level, I have been there, I have done that. I'm more than happy to share my resources and how to get there, because it's really amazing to see simulation-based education picking up momentum in India. So primarily I'm from Goa, and I had this conversation a couple of, maybe 2 years ago, just pre-COVID, with some high-end delegates that I know in nursing in Goa. And they were looking at me as if I was crazy. Like, you know, what is she talking about? Why do we need mannequins? Why do we need part-task trainers? We have patients, we have exposure. And then comes COVID. And then they are like, we don't know what to do. So I'm really happy that COVID worked well in this way. And it's really nice to also see other modalities of teaching, of learning and teaching. So I think experiential learning or simulation-based education is here to stay, and we all have to welcome it with open arms and incorporate it within our teaching and learning styles. Okay, so that's about myself. Let me just share my screen right now. Okay, I hope that the screen is visible to everyone.
Yes, ma'am.
Yes, thank you. So the good part of this screen sharing now is I can only see the screen and nothing else. Okay, I cannot see myself. I cannot see any of you. And it's nice to keep it that way. I would really love you all to be interactive. Please talk to me, unmute yourself, feel free to talk. During this presentation, I also would like you to put in comments. I will not be answering the comments parallelly to my talk, but I'll definitely make a point to answer it after the session is over. Okay, so my session today is Essentials of Simulation. Before I go into the proper presentation, I just want to tell you a little bit about myself. So I already said primarily I'm from Goa, and I moved to Dubai after I got married a good 11 years ago. And here are two pictures of the states or areas that I've been in the last 10 years. And one is Goa, because I'm from there and it's very close to my heart. And the other picture is from the United Arab Emirates, which is Dubai. And whenever we talk about Dubai, we speak about glitzy things and fancy things, but then there is this also other side of Dubai with mountains and hiking. And if you're a trekker, it's really beautiful to explore these less known areas. So I always make it a point to show the other side of Dubai to everyone who's attending my presentation. The objectives of this session today are to define simulation, which has already been very well defined in, I think, the initial 30 minutes, discuss the history of simulation in healthcare, describe the simulation activities conducted to the center at various capacities, list down the modalities of simulation, and discuss the resources needed for simulation. Most of the part today that I'm going to discuss is things that happen at the Mohammed bin Rashid University of Medicine and Health Sciences. Now, along with the senior simulation educator, I also hold the title of lecturer for College of Nursing. We just have a postgraduate nursing running here in two specialties, pediatric and cardiovascular. So we use a lot of simulation-based education for them as well. But we have another two schools, which is the College of Dentistry and the College of Medicine, also again, which is very simulation intensive. So as we progress through this presentation, you will see that there's a lot of simulation that we use here at our university. So I know that simulation has been defined and discussed, but this question is basically for the faculty who's attending. I want to know, what is your take on simulation? What do you think is simulation? I'll just give you a few seconds to answer this question. So what do you think simulation is? Anyone?
Madam, good morning. This is Vadiyukarasi from Silvassa. Thanks for your session, madam. As per our thing, like we are making a scenario, and with the mannequins, we are trying to teach. It is the other way around with the advanced demonstration techniques.
Absolutely. Yes. Thank you very much. Yeah. So, yes. Anyone else? Requesting to please mute yourself. Requesting, I can hear some sounds from some other participants. So if you can, if it's not the answer, please don't share it with me. What I'm looking for is only the answer to what is simulation.
Excuse me, someone who is with the Redmi 8, named with Redmi 8.
Okay.
Kindly
Thank
mute
you.
yourself.
Okay, so what is simulation? Basically, it's a technique that creates a situation or an environment to allow a person to experience a representation of a real event, okay, for the purpose of practice. Now this could be learning, evaluation, testing, or to gain the understanding of a systems or human actions.
I request someone with name Redmi 8, kindly mute yourself.
Sharon, ma'am, you can continue. We have muted the participant.
Madam, you are muted, madam. Please unmute.
Okay, is this fine?
Yes, ma'am.
Yeah, can you hear me now?
Yes, we can.
Just give me a minute. Okay, yeah. So coming back, so it's a technique basically that creates a situation or an environment to allow persons to experience a representation of a real event for the purpose of practice and learning. Okay, evaluation, testing, or to gain understanding of the system. So it's not only to learn, it could be for practice. Simulation can be used for learning, simulation can be used for evaluation, it can be used for testing. Okay, or it can be used to gain understanding of the systems of human actions. Now, as I said, if you experienced simulation before, and many of you will say no. Okay, but if you look at this picture, you'll have done it before as children, probably, as teenagers, probably, or even as adults. You see this really nice picture here with a girl holding the doll. How many of you, when you all were younger, actually had dolls and used to feed them and care for them and treat them like your child? Yeah. And at that point, you used to simulate the role of a mother. Yes. If any gentleman over there, you will relate with the toy soldiers. So I still remember during the festivals, you used to get these toy guns that everybody used to buy them and shoot at each other, thinking that you could actually save the world and just keep on shooting. Yeah. So at that point of time, you really thought that you were the soldier and you were protecting everybody over there. The third picture, you can see cooking. I'm sure as kids, as children, or even as adults, all of us have tried our hands at cooking, and we thought we were the most amazing chefs, which we weren't at that point. Yeah, but still we cooked with that feeling. We cooked with that soul. And that is the beauty of simulation. Simulation brings out those emotions in you, those feelings in you that are hidden otherwise. That are hidden when you're teaching something or when you're learning through lecture, that are hidden when you're probably learning with a peer. But when you're doing it, when you're in that environment, doing that particular action, there are different emotions that are brought out, and that actually helps you to understand the concept better. And that is the simulation we are aiming for. A little bit of history of simulation. So simulation is not a new concept. If you see, there are so many simulated activities back then in China. So, you know, the acupuncture. So acupuncture was a very famous therapy in China. So if you go back to thousands of years ago, they used to teach acupuncture on these huge bronze figures. Okay, so these huge bronze figures had a network of water inside them, and this network was then sealed with wax. So as an exam for an acupuncture, what they used to do is they used to ask the student to pierce the body on that particular area, wherever it is. Okay, and if a drop of water is seen through that pierce, means you passed that acupuncture test, you passed the needle test. So it was a form of simulation. That way they used to see if they knew the accuracy of the point, because only if you press the pin at that point, the water used to come up. What you have here are some very famous simulations. You can see airway simulation, you can see simulation for war. Okay, this type of a pelvic model and the baby is actually kept in a museum in UK, but I'm sure so many of you actually use this. I remember when I was doing my master's as well, one of the biggest props was the pelvis with the cloth doll that used to use to show how a normal delivery and various other rotations would take place. Yeah, and the fourth figure here is the Laerdal Annie, which is very famous in the basic life support course. If you've done your basic life support course, you have done it on a Laerdal Annie. So that's the fourth picture here. It's more than 100 years old, the mannequin, but it's still there till today. Yeah, because it is one of the most effective mannequins probably that was created, and it serves the purpose. Okay. I have a small video here for all of you to watch, and I'll show you a few seconds of it and then we'll discuss it. It's a cartoon video from the movie Monsters, Inc.
Good night, sweetheart. Good night, Mom.
Sleep tight, kiddo.
Simulation terminated. Simulation terminated. Simulation terminated. Simulation terminated. Simulation terminated.
All right, Mr. Bile, is it?
My friends call me Phlegm.
Uh-huh. Mr. Bile, can you tell me what you did wrong?
I fell down?
No, before that. Can anyone tell me Mr. Bile's big mistake? Anyone? Ugh. Let's take a look at the tape. Here we go. Right. There. See? The door. You left it wide open.
Okay, so I just want to ponder on this video. So this is classically how a simulation scenario takes place. Okay, there's a group of students. Out of that, 1 or 2 students are chosen and they are put in the simulation area or the simulation room. The rest of the students observe that student through a camera or along with the facilitator or the faculty. And after the session is over, they do something called a debrief. Okay, the debrief what the lady was doing there, she was actually asking Mr. Weil what were his mistakes. Now, one of the biggest things to learn from this is the first question, what she asked is, can someone tell me, or just type it, what do you think is an issue here? And then probably I'll just give you a couple of seconds to type it and then I'll continue. So one of the first things is she asked, what was your mistake? Okay. And that probably, I think, is something that we need to defocus on. Yeah. focusing on the mistake. Rather than focusing on the mistake, we need to look at the procedure as a whole. Yeah, look at how the simulation was done. And also look at, there were many things that went on well during the session. So we need to discuss those as well. So it's not only about mistakes and how we can improve them, but it's also about good practices and how we can standardize those. And that, I think, would be my takeaway line for this session, is how we use simulation. That's really important. So why simulation? Why simulation? So in hospitals, in universities, in airlines, everyone is using simulation. But why is it? It's the simple cartoon which I have over here, okay, where he says that I have taught Snoopy to whistle. Okay, his friend says, but I can't hear him whistle. And he says that I said that I taught him, not that he learned. And simulation and skills training gives us the ability to re-demonstrate, for the students to re-demonstrate what they learned, and for us to identify if the process is standard, if the procedure is standard, and if we are happy with what they have learned. Because again, the perceptions of learners are different, the learning styles are different. There are so many different kinds of learners. So it's very important to use all the elements of teaching and learning when we are conducting a session. I'll just brush through a few modalities of simulation. All these photographs are taken from our center. If you can see here, there is a part and complex task trainer. So you see the students here, they are practicing something on an IV arm, that is the IV insertion. Okay, so this would be your part task trainer. It can, it's also called as complex task trainer in some areas. Our simulated patients, if you can see over here, this is our range of simulated patients. If you see over here, so we have a very, very good simulated patient program, and I take great pride in saying my colleague, she leads this program. So right from recruitment of simulated patients to training, okay, we actually have a very, very strong program. Next is the simulation modalities. If you see here, this is just one of our simulated, our high fidelity patients. Okay, so it's, we call him Hal. He's a 6-year-old boy or girl, depending on how we dress him. And we have these mannequins in all ages, right from 3 months. Then we have a 1-year mannequin. Then we have a 6-year mannequin. And then we have adult mannequins in all shapes and sizes. So we have a lot of high fidelity patient simulators. They look very, very much like robots. They talk to you when you're spoken to, but of course you need to have somebody in the background to talk in real time. They blink their eyes, you can hear their heartbeat, you can feel their respiration, you can check all their pulses, you can intubate them, you can insert IV lines. There's a wide range of things that you can do with these simulators. Okay, last but not the least is the screen-based simulation with haptics, where you not only engage yourself mentally, but you engage yourself kinesthetically as well. So you can see here that he's performing a skiing activity. And this basically is a simulation activity in surgery to improve the hand and eye coordination, because for robotic surgeries or surgeries using microscopes, there's a lot of this simulation that is used where your eye movement and your hand movement needs to be really coordinated. And this is one of the simulated practices for that. Okay, the next would be a simulation setting. So we talked about the resources. So where do you think you conduct simulation? Everybody says that yes, in simulation labs or in a space, in a classroom where you have the mannequin or the simulated patients. But I think where you conduct simulation, your imagination is the limit. Yeah, you can conduct simulations in the simulation lab. You can conduct simulations in the hospital that you're going to and the hospitals that you're visiting. You can, if you want to do an accident scenario, you can conduct a simulation on the road, take permission and do it on the road. If you're doing a scenario for school children, you can do it at the school. If you're doing it for the receptionist, you can do it at the reception. So there is no limit as to where you can conduct the simulation session. It is an open book, and it is for you to map out what is your story and what is your simulation story. What do you want your children or your students to learn? Okay, these are some pictures again from the simulation center that I am a part of, and I very proudly present these pictures. As you can see, we have dental simulation, we have an intensive care unit, we have a maternity suite, we have an operating room, and we have a medical ward as well. So we have all this equipment. The equipment that we have in a simulation center is real grade equipment. It's not fake. It's the same equipment that we use in the hospital. So whenever somebody comes to learn how to use probably a resuscitator, they are learning it on an actual resuscitator. They are using actual IV cannulas to insert IV lines. They are using real ventilator equipment. So all the equipment that we have is real grade, hospital grade equipment. Just for you to again understand slightly better, I'm going to show you a video, and this video you will see my director, my team, and it will also open your eyes and your views on simulation and how we here at Mohammed bin Rashid University of Medicine and Health Sciences are using simulation not only for teaching and learning, but for so much more. Yeah, so I really hope you enjoy this video.
Hi, I'm Dr. Nabil Zari. I'm a professor of medical education. I'm also the director of the Institute for Excellence in Health Professions Education. Warm welcome to the Mohammed bin Rashid University of Medicine and Health Sciences, and more specifically to one of its Center of Excellence, the Khalaf Ahmed Al Habtoor Medical Simulation Center. As you go through the visit, I would like you to remember two main objectives: to look at how we increase the quality of care, but also how we ensure that the patient remains safe, which is called patient safety. And the way we do it is we support our undergraduate and postgraduate students at MBRU to improve their clinical competency. But also, we follow the health professionals during their work life to maintain and improve their competency. So once again, I would like to welcome you to the Khalaf Ahmed Al Habtoor Medical Simulation Center, which is a globally recognized center and the biggest center in Dubai and Europe. Thank you.
In simulation, it is important to make the experience as real as possible. For that, we at Khalaf Al Habtoor Medical Simulation Center are using the high-fidelity simulators to improve the quality of training. We have several different types of high-fidelity simulators, like adult male simulators, adult female simulators, birthing simulator, kids simulator, baby simulators, newborn simulators. Most of the high-fidelity simulators have a common features like chest rising, heart sound, lung sound, convulsions, bleeding. You can even talk through these mannequins. To add more realism to the simulation, we designed a lifelike situation by using moulage to create fake wounds, burns, bleeding to enhance the realism of that training.
Simulation is not only technology-based, it is human-patient-based also. At MBRU, we involve community into health professions education through simulated patient program. Simulated patients are trained individuals who portray the roles of patient, their signs, their symptoms and problems. They contribute towards teaching and learning, assessment as well as research. We have a well-established simulated patient program at MBRU and follow international standards of best practice.
Community engagement is one of the strongest pillars of our simulation center. Right from introducing small children to healthcare environments to helping the older ones in choosing healthcare profession as a career, we have a wide range of experiential learning opportunities for healthcare professionals and the community.
Simulation helps to link theory to practice. And at our simulation center, we give a lot of opportunity for the students to practice, demonstrate, and get assessed on the skills. We also have a lot of task trainers, mannequins, and simulated patients where they can practice their clinical skills. We use the principle of scaffolding, where they go from basic to advanced skills, and ample opportunities for them for deliberate practice so that they can become proficient in the skills.
Yes, so that is our simulation center for you. I know it's a lot of good things. I know it's a really beautiful center and we take great pride in being part of this great organization. So moving to limitations of simulation. Okay, I know that I just have probably 3 or 4 more minutes to conclude this. So we spoke about so many good things about simulation, but you know, not everything is like so bright and fancy. There are also some limitations in simulation. So I just want you to list down if you think that there are some limitations in simulation. Okay, if any of you wants to unmute and just share limitations, I'm open for that as well. But just make sure that after you say this, please mute yourself again. So what do you think are the limitations of simulation?
Time consuming and need to have a critical thinking to set the scenario and then ensure the control over the complete scenario.
Absolutely. Thank you very much. What else? I'll put this in perspective for you. So to run a simulation, you need a faculty or the resource people. You also need a resource environment, as you saw, okay? And you also need the audience. So it's these 3 areas that you could think of in limitations. What else do you think? You've seen the videos, you've seen how it is done.
In simulation, we have a control environment, whereas in real situation, in simulation, we can predict, or as a teacher, I can predict that this would happen.
Yes. Yes, that's very true. Also, you were also, I think this is just by the voice, I feel that this is Jyoti. I didn't hear the first sentence. You were breaking up a bit, but I did catch the remaining sentence. Yes, you can predict what's going to happen, but think of it like this, a scenario where you have not a simulated patient, where you have probably a mannequin. Yeah, so you set all the parameters of the mannequin and you press enter on your laptop and you expect the mannequin to have this particular blood pressure, the temperature, his BP, everything is set. And just as the student enters the room, there's power failure and the mannequin conks off. What are you going to teach? Yeah. So with great technology, I feel comes great responsibility. Yeah. Same thing for a simulated patient. You have invited a simulation patient over, say for an exam, and your exam is basically to, check, your station is to check the vital signs of this person. Everything is set. The student is there, the examiner is there. And that morning, your simulated patient doesn't turn up. What do you do? Okay, so these are the limitations of simulation. We can predict to a certain extent, but there are so many variables. One of the biggest variable again is the unstandardized way of teaching simulation, because simulation idea of you is different to a simulation idea of me. So it's very, very important for all the facilitators to be trained to actually give this simulation, because everybody knows what a lecture is. I know what a lecture is. Okay, all of you know how to deliver a lecture, but not everybody knows how to deliver simulation. So it is very important again to standardize the process and to have a knowledge and know-how of how to do it. Otherwise, it could be very psychologically unsafe for the student who is on the receiving end, who is participating in the simulation. Another thing is simulation is very expensive. I see it as a limitation. Not everybody can afford this kind of equipment, this kind of a center. Okay, I'm fortunate to be a part of it, but I know very few universities can afford this kind of luxury. So again, I see that as a huge limitation. Another limitation is our sizes. Okay, so research-based, evidence-based research shows that in simulation, the groups cannot exceed 12 per group. You can see this is a picture of me in a debriefing session, and we have around 6 students. So 6 to 8 to 10, that's the maximum number of students we take for one session. So you can imagine if you have a cohort of 150 to 200 children in that, how many times you have to repeat the session and over how many rooms. So again, it is resource intensive in terms of time, equipment, faculty. Although the learning outcome is very, very high, it is very, very resource intensive. So all I would say is, when we think of simulation, it's great. It's to have, it is the way forward. But I would encourage everyone to pick and choose what is really required to be taught through this modality and go for that. Not anything and everything can be taught. It can be taught in simulation, but because of these limitations, we need to think critically. We need to think of what is it that we want to include? Why is it that we want to include? And what is the patient-centered goal? What is the long-term impact? Because at the end of this, whatever we are teaching our students, the end result is patient safety and nothing else. Because no matter what you say, no matter if you say yes, the students will learn well. Ultimately, who are they practicing it on? They are either teaching new students how to do it, or they are practicing it on the patients. These are the two outcomes. So in both ways, the end goal is patient safety. So with this thought, I end my session here and I am open for discussion. Thank you very much.
Thank you so much. The picture you have used was really very emotional. Like a picture which we used to apply in our daily life. Example of that, pelvis. Pelvis is an integral part of midwifery and gynecological curriculum. So the video, the explanation of the topic with the help of video, it was just excellent. We are very grateful to you, Sharon ma'am, for sharing your experience with us. Now the session is open for the discussion. Anyone having any doubts from the audience? I guess no doubt. So now let's move to our second session. So the second session is by Dr. Anu Grover. I feel simulation in India is known by your name, ma'am. Ma'am has trained so many faculty throughout the India, also the faculty from the abroad also for simulation. So now I will look on the ma'am curriculum. So, ma'am is presently affiliated as a Director, Simulation Training Officer, National Reference Simulation University, Gurgaon. Ma'am has done Masters in Obstetric and Gynecological Nursing, having an experience of 9 years and having experience of 3 years as a simulator trainer. Ma'am is presently affiliated as a Master Trainer of Simulation Education Methodology and has trained more than 255 nursing faculty batches organized by Nursing Council. Ma'am is a Master Trainer of Capacity Building of Midwifery Faculty, Module 2, and trained 140 midwifery faculty across India. Out of them, 140 midwifery faculty, I am one of them, and abroad in 7 batches organized by Indian Nursing Council in collaboration with UNFPA. Instructor of American Heart Association, Certified Basic Life Support and Advanced Cardiac Life Support. Training Center Coordination of International Training Center, SGT University of American Heart Association. Organized various programs at National Reference Simulation Center like Neonatal Resuscitation Program India, Induction Training of New Nurses in Obstetric and Gynecological Nursing, American Heart Association Certified Basic Life Support, Compression Only Life Support Training for Non-Teaching and General Public and Community, First Aid Training for Non-Teaching Staff of SGT University, attended various workshops and conferences at national level. Ma'am has total 12 publications, national and international journals, and few of publication as Scopus Index, briefed about simulation methodologies to various national and international delegates at National Reference Simulation Center, SGT University. I welcome you, ma'am.
Thank you. Thank you, Ramandeep ma'am, for the brief about me. First of all, I would like to thank Dr. Jyoti Kaithwal, who have approached me and given me this opportunity, and especially to you as well, who were just and I would like to congratulate the organizing team for making arrangements and organizing a wonderful topic, which is the talk of the town these days, that is simulation in nursing curriculum. So the topic I got, it is the process of simulation. So whenever we move further with the things, and before that, I would like to give my regards to Dr. Jyoti Sareen ma'am and Dr. Sukhpal National and International Mrs. Sharon and Dr. Manju Pallat. I would like to further proceed with my topic. That topic is I got is the process of simulation. So let me first share my screen to you. Ma'am, I'm not able to share the screen. Can you please able me to share the screen, Ramandeep ma'am?
Now you can. Please try. Anuman, can you do it? And I need you to post.
I hope it is visible to everyone.
Not visible, ma'am.
Let me see. Ma'am, I'm not able to share my screen again. Can you allow me to do that? Yeah, now it is. Is it visible now?
Yes, ma'am.
Yeah. So the process of simulation is one of my favorite topics, I can say. So luckily or fortunately, I got the same topic. I would like to thank again the organizing team, Dr. Jyoti as well. So simulation is a process used to reproduce an event before it actually happens, which is a very important thing when you send your participants or when you send your students to the clinical area, they should be exposed with what they are going to encounter in the clinical practice, right? If you can see this picture, this is a picture for one of the trainings we are conducting here at National Reference Simulation Center. So before proceeding with my topic, I would like to have you around because I am here at National Reference Simulation Center. So I would like to take you through the round of Simulation Center, that what actually we are doing here and what is actually about the center is. So please let me know if this video is visible to everyone.
Yes, ma'am, it is visible.
Can you see the screen now?
Yes.
Yes, ma'am.
So this is the video of my journey when I started simulation, when we are being trained in simulation in 2018. So we have been trained as a master trainers in 2018 by Ladle itself. So they people have come here and they have trained us to train the people around India and abroad, right? So moving further with my topic, like I would like to give you an outline. We'll be covering the components of circle of learning, simulation, components of pre-brief, simulation scenario, and what are the phases of debrief. So before starting with my presentation, I would like to let you understand that what methodology and what is the, we are acquiring here with the students. Like when students come in the center, we are making sure they are going through the circle of learning. So when they're going through the circle of learning, the first component which we talk, if you can see here, is knowledge acquisition. So we are making sure when students are coming to the simulation center, they are acquiring knowledge before they are moving further with the skills. And once they acquire knowledge, they are moving to the labs, that is skills proficiency. Skill proficiency means they are becoming competent in the psychomotor skills by using the knowledge they have acquired in the classes from the teachers as well. And then further moving in the third component, that is decision making. In decision making, we are making them more competent in facilitating their thinking process, which is very much required, especially in nursing. So we are keep on waiting for the doctors to come, and we are moving, like doctors will come and they're giving orders. So here we are making the students competent and we are making them confident when they being trained for the skills and decision making. Once these three components are done, knowledge acquisition, skills proficiency, and decision making, then we are coming to simulation in teams. Simulation in teams, like if you see, the three components are all individual. So simulation in teams, that we have to work together in a team. It's not only you who are working in a hospital, it's not only you who is dealing with the patient. It's like you have your coordinators, you have your co-faculty, you have your co-colleagues, your senior nurses, junior nurses. Moreover, we have the patient relatives, which is again an important part of the care of the patient. We need to understand how to communicate the things with them and how to work in a team. When you play in a team, then things could come in a good output, right? And once my students are more confident in all these four parameters, and when they learn how to manage by replicating the real life situations in the simulation, they learn and they practice that in the clinical area when they're moving further. If you see the circle of learning, it has 5 components which has to be achieved by step-to-step manner. if we feel as a facilitator, as a teacher, as an instructor, I feel my student is very good at knowledge, but somehow he should be more confident in the skills. So I'm making sure that I'm taking one component out of it and I'm making them confident in that specific component and moving further. So it is not that we have to take all components all together. That totally depends on your observation and evaluation and as per the need of the student, right? And if further you see the circle, which is getting darker and broader in red color, which indicates further you're moving with the further components, you're getting to know more knowledge and the circle keeps on going. It's not like that once you have went or once you have been in the clinical area, you are very much knowledgeable. So you are learning more and then you are again practicing the things in the same manner. So this is the way we are dealing here in National Reference Simulation Center, right? So now we are talking about simulation in teams. It's the fourth component of circle of learning, which says it is an artificial representation, as already Mrs. Sharon has told about, that we are replicating the things, and it has been identified that we are replicating things in the centers, in the labs, wherever we feel. As ma'am has very nicely told, it is not like that we have to replicate this situation in the labs only. This has to be replicated according to the situation and according to the setting you want. It's again, I would like to highlight one more thing, that sufficient fidelity. So if we talk about sufficient fidelity is like a degree of realism. So degree of realism, we are talking like it is not only based on the technology. It is like we are talking about the technique here. So simulation is not about the technology. If we don't, like people have the notion that if we don't have high fidelity mannequins, if we don't have high fidelity like simulators, how we are going to run the simulation with the students. It's not like that. I would like to highlight again, it's not about technology. Simulation is all about technique, how you run. And this is the technique we are going to discuss in this presentation further forward. And once you are replicating the situations in the labs or wherever you feel the setting is comfortable for the students and it should look like a real or should be with sufficient fidelity, definitely it is going to reduce the risks. As Dr. Jyoti Srin very beautifully, she explained that we are helping the students to commit the errors here. So when they commit errors, when they commit mistakes, when they do mistakes, then they learn more. Because when you do something, you learn more. So we are learning from their own mistakes. So that's why when they learn in the clinical, that is the problem for the teacher as well as for the students, because there's a performance pressure. Because when students are working in clinical areas, it is really difficult to let them do the things by their own. We are on their head whenever we feel they are doing something, and that performance pressure is coming. But here in simulation, we are giving them a psychological safe environment, that safe container we are providing for the students, where we are allowing them to do mistakes as much as many, right? So when they do mistakes from themselves, they learn from their own mistakes, and definitely it is going to reduce the risks in the clinical practice. That's why we are adding this third point, that is minusing the risks, minusing the problems in the real life situations when they're going to actually practice in the clinical area, right? So what do you think simulation facilitates? It facilitates learning in which manner? So we have the simulation when we are allowing the students to get immersed, to take the roles, to take up the seats. Like some of the participants are on the hot seat, as Sharon ma'am has explained beautifully. Like she told that we are not able to give the chance to everyone. So we are taking a small group, but that small hot seat. But many researches, evidences are saying that the students who are not on hot seat, it's not like that they are not learning. So they are equally learning because they are becoming the observers, and that's the role of the student that they are doing. So they are experiencing the things by immersing themselves in the situation which we are providing them and they're encountering. So once they are into the scene, when they're sitting for the debrief, then they're reflecting back that what they have done, what they have to learn, what they have done with the patient, and what care they have provided. So based on their reflections, it's a facilitator, it's like we who are going to make the constructive feedback. So I would like to highlight here constructive feedback, as the video has shown in the cartoon video has shown in the previous presentation. In that, she's asking what mistake she has done. As ma'am has also highlighted, I'm again focusing on the same thing. It's not about we are taking out the mistakes. It's not about we are giving them that this is done, this is not done. It's like we are asking the students what they have done and what was good in that, and how would they would like to improve in the next sessions. So that's constructive feedback is very, very important so that we can facilitate learning. And then once they are done with all this experiencing, reflection and feedback, so then they can go for further practice and they facilitate learning through these 4 principles of simulation, right? So now coming to the point, that is process of simulation. So if you see, this is the slide which tells what is the structure and what is the process of simulation. So there are 3 basic things, 3 basic components of simulation. The first one is pre-briefing and scenario, and then there is debriefing. If you see in this, the size of the boxes, definitely the color is not going to make any difference. It's just I have differentiated because of the different components, but the size has a great significance, which indicating that what time, how much time you are going to give to which component. That's very, very important. If you see, the pre-briefing and scenarios almost of the same timings, and then debriefing is have a long block and it is taking much time for the students where actual learning is taking place. So in the pre-briefing and scenario, when you talk about the newer methodologies, we are saying that it is all about experiential and reflective learning. So here simulation is answer to that queries and solution to that methodologies which come across to our mind many times. So experiential learning is like they are immersed in the scenario. They are learning during the pre-brief, they are learning during the scenario. So we'll be further going further with the PPT presentation, we'll be elaborating more. And if we talk about debriefing, it is all about reflective learning. When they sit for the debriefing with their teacher, with their facilitator, they learn more what they have experienced and what they have done. So they reflect back, and that is, we call it as a reflective learning, right? So moving further, I would like to start with my components of pre-brief. If you see in this circle, we have the main 4 components under the pre-briefing. The first is introduction, then we have an orientation, patient parameters and role. I would like to highlight one thing, how you prepare your scenario, how you design your scenario, that matters. And the most important, further more on that, it depends how you pre-brief that, because pre-briefing has a limited time. When you prepare your scenario, we have people who are giving their inputs and we have time, we can take time how to design. So if you have designed it in a very planned manner, definitely your pre-briefing will go accordingly. But again, I would like to highlight how you pre-brief your students, how you pre-brief your participants, it tells that how beautiful the scenario will go. So pre-briefing is very, very important to start with. Pre-briefing is important, that how you are pre-briefing, it is going to let the scenarios take the shape accordingly. So that totally depends on you, how you're pre-briefing your students before running any simulation scenario. So further moving to the components, if you see these all pictures like from our National Reference Simulation Center, and I feel pride that we are conducting lots of trainings here with the students, with the participants, with the nursing faculty. So we have different modules here which we are running with the different participants who are coming across. So if you see in the introduction we are giving, it's not about self only. So introduction is self means me as a facilitator, and self, we are talking about the participants who are actually going to perform here, who have come in the simulation scenario for the session. So introduction is very, very important. So why we are talking about introduction here? So when you introduce about yourself, who am I? I'm Anu Grover. So I'm today's facilitator for today's session. So that gives a good rapport with the students. They know who am I. And definitely it's really important to get back from them that who are they? Because you want to understand your audience to whom you are going to teach. That's very, very important, because it is going to make you comfortable, not only for students, it's going to make you comfortable that how you're going to proceed your learnings accordingly. You have the first year students with them, you have the 4th year students with them, and many more things. Like it's really, really important to exchange the introduction with your name and specialization or the year and specifications, right? It makes you comfortable and that relieves the anxiety. As we talk, the psychological safe container. Simulation is psychological safe container. When we talk, it's really, really important to make sure that we are making them more comfortable by giving introduction about each other, right? Coming to the time, the second point here is time. Time indicates, like, it's not about how much time I'm going to take in pre-brief. It's like we are going to give them time that for 1 hour at least we are here. Why it is important? Because when I was a student, I used to go to my classes when our teacher comes. So when they open the slides, I usually see the number of slides, the first thing. Because it is always in students' mind for how long this teacher is going to teach us. So if we have given the time frame already to the students, it's very, very important to give that we are here for next 1 hour and we are going to do this. So that students are already, they're making their minds and they are more comfortable that we know than from now today, from 11 to 12 noon, we are here with this teacher and with this facilitator to making them immersing and getting into the roles. Coming to the previous knowledge. So why do you think it is important? I feel it is very, very important because if my student, talking about the circle of learning, if my student is not well versed with the topic, if my student is not well versed with the skill I'm going to deal with, if my student is not well versed what decisions she or he has to take, there's no use of running a simulation scenario here, because when you put them in the scene, when they're going to encounter that, definitely it is not going to make any difference. And then again, it becomes a theory class. So it's really, really important to understand that what previously they know about what we are going to do today. So that's very, very important. And sometimes it happens that students are sharing something and then and there we can correct them. And then and there we can impart a little knowledge about the topic so that we can proceed further with the scenario we're going to plan or we're going to run with the students. Ground rules. For me, it is very, very important. When you talk about the ground rules, we have some rules for the simulation. When I talk that my students are here, they all are classmates. And when we have the participants from different institutes, some are very senior, some are very junior. So there is an anxiety with the students. So that's very, very important to tell the ground rules. We are not here going to be judgmental for each other. We are not here to judge anybody's actions or reactions. We are here to learn and we are here to respect each other's actions and reactions. It's not about that who knows much and who knows less. It's about we are going to learn from each other. We are learning or sharing our experience. Whenever our participants come, as Raman ma'am said, she's one of the participants here, and Dr. Supal has mentioned that she was the participant of the first batch. It's not we are the trainers. It's not we are the instructors. It's not we are the facilitators and we are the simulator experts. It's like we are learning from each other. We are exchanging our knowledge. It's not always the teacher is only teaching. It's not always the trainer is only training the trainees. It's like we are exchanging the knowledge with each other and we are learning from each other. Some things one person is very good and some things others. So we are going to learn with a mutual understanding and we are making sure we are going to respect each other's learning by not getting judgmental on the actions and reactions on each one. So this all, when you talk about the introduction, these all things are going to make sure that students are not anxious what they're going to do today. We are making them psychological safe. In the ground rules, the other thing is like, we are talking about who am I? Where will I be? I'm the facilitator, but I'm nowhere in the scene, because students should not have that idea that teacher is again on my head and who will be there. Some people, some cameras are there. We are going to recordings. We are talking about other things. And most important, last but not least, most important, the confidentiality. It's not that every student is good at the things. It's like some students are very slow at learning. Some students are not good at skills, maybe many reasons. I'm not saying the student is weak and student is poor, not good at studies. There can be many reasons. We should not be assumptive in that. We should understand their frame of mind. And we will make sure that we are not going to discuss their actions and reactions. And we are making sure with the students also that they are not going to discuss what has happened here. We are just going to take out the learning out of it. And fiction contract. Fiction contract is like we are helping the students to understand this is not real. They know, we know, but again, we are helping the student that they have to feel it like a real situation. So that's very, very important to run any simulation when you talk about the ground rules. So that's important component in the pre-briefing before starting with further things. Coming to the orientation. When you talk about orientation, it's not the orientation of some specific things. When you even go to somebody's house and in the personal setups, always we need what are the things lying where and where are the things we have to do. So that's again another beautiful thing which we are doing with the students, that we are understanding making them understand where the things lying. We are orienting them what we are going to do today and what and where we are going to do the things. So it's really going to help the students. So whenever students enter, we are orienting them the situation. So in the orientation, the first most important thing is learning objectives. So whenever you're running any session, it's really, really important to talk about the learning objectives. It's important for the students to make their minds, to frame their minds and learning what they have learned so they can relate the things further later what we are going to proceed. So learning objectives, it's not like that we have given. It's like we have to reinforce what learning objectives are. Once I have said these two are my learning objectives, definitely it's important to get back from the participants, from the students that would you like to chalk some of the learning objectives which I have just discussed. Or moreover, you can take a board and you can write it anywhere so the students understand that this is my learning objective and I'll be moving around in and out of this. So once the learning objectives we have given to whole students, 7 or 8 students standing in front of me, we're talking about the setting. The setting is important because they should know they are in labor room. They should know, are they in community setup? They should know, are they in some ICUs? Very, very important. So they can also understand that they can relate back with the objectives that if I'm running a scenario on the antenatal women, I should have that setting and I should have this table and chair, and this is the examination table should be lying, and these are the things should be lying. So that's very, very important to make them, give them brief about the setting, that this is the setting where they have to go for hand washing, where they are going to discard the waste, these all things. This is the infant ready and warmer lying this. That's very, very important. Coming to the equipments, it's almost the second sub point of the setting, but yes, equipments is again playing an important role. So equipments is totally depends how you prepare. When you're preparing your room, you're keeping the equipments as per the scenario. But again, you can always, if you can see in this picture, the third picture, the students are hand holding the equipments. It's not like that Anu is explaining everything. It's not like that the facilitator is explaining everything.
Anu ma'am, you're not audible.
Ma'am, your voice is not audible. technology can be very unpredictable at times, and this is what we are facing right now. And Dr. Anu has some technical hitches. So by the time Madam joins us back, can we have something from the participants? How are you finding as we are going late? I didn't understand all of you are already engaged and you have spared some time for us. But few things that are out of control, we cannot control them. So this is where we have landed right now.
Hello, ma'am. Am I audible now?
Yes, ma'am. You are audible now.
Shall I start again?
Yes, please. Please.
I'm disabled to share my screen. Can you do me able?
Yes, ma'am. I'm in it. Done, ma'am. Please try it.
Yeah, I'm doing. Is it visible now?
Yes, ma'am.
Okay. So I think I was on the equipments. When you do the learning objectives and when you have given the setting to your students, when you're coming to the equipments. So equipments are very, very important. You are allowing the students to handhold the things. When students are hand holding, then only they learn. So I was giving one example. I always give to my participants and students. When one of my students is not well versed with the equipments before, so what is happening? They are not able to use that equipment in the clinical, or they are not able to use that equipment in the simulation as well. So when you talk about experiential learning, it's not the experiential learning they're doing in the scenario. The experience they are learning also when they are going and hand holding the equipments, when you teach them, when they are going the orientation, going through the setting and everything. So it's the role and the responsibility of the facilitator to allow every student. If you can see in the third picture, the students are themselves hand holding the things. So they feel more comfortable that how the things hand to be holded. So their experiential learning is taking place from the pre-brief itself, which is again going to happen in this scenario. Talking about the patient and simulator, very important. As Jyoti ma'am has said, it's not about the simulator only. It's not about the high fidelity mannequins only. It's all about the standardized patient. As I highlighted, the simulation is not about the high fidelity mannequins and not about the technique. It's all about technology. So whenever you are giving the orientation to your students, you make sure you are giving the limitations about the patient and your task trainers or the simulator which we are going to use. Further moving with the patient parameters, very, very important aspect. So the patient parameters has further points, how, when, where, and who. So if you talk about patient parameters, that all we have planned in the scenario, that how we are going to give the readings. The readings will be given, I'm going to use the flashcards. The readings will be given, I'm going to tell the students that they have to see in the monitor. The readings will be given when they are going to get the readings from the verbalizing by the facilitator. That totally depends how you want to give, but it's really important to give the pre-briefing about that. When, where, and who. So when you're going to take or put the stethoscope, then only you'll get the heart rate of the newborn baby. Where it again depends that they are going to see on the screen, they are going to take it from the flashcards, and they are getting verbalizing by the facilitators. Who? Definitely it's you. It's you or the technician to whom you have pre-briefed that you are going to give the readings based on the scenario the students are running around, right? Coming to last component of pre-briefing is roles. So why the roles at the last? First, I would like to talk on this. The roles at the last is very, very important, because if you are given the roles to the students in the starting, the students who are on hot seat, they'll be learning many aspects. The students who are observers, let's say, who's a relative and who are not on the hot seat, they will not understand what you are talking about. So roles should be always at the end. So at least what experiential learning is going to take place in the pre-briefing, that should happen equally. So we are not making other people's relax, and we are just putting the pressure on the people or the students or the hot seat, who's a senior nurse or the junior nurse, maybe the doctor or whosoever. So it all depends. You want to give the roles voluntarily, and it again depends on your evaluation, that if some students are escaping always, they are not happy to take the roles always on the hot seat. So it's your role as a facilitator that you can give the role specified to the specific students depending on their need. Once the volunteer roles have been given, you will be going for individual briefing. And once briefing is all over, then again, we are talking about the scenario, that how the scenario is going to start, where the scenario is going to start. When you are there in the scene, then the scenario is going to start. And when I'll say start the scenario, then the scenario will start. That totally depends on you. Another important aspect here is checklist to the observer. If you understand, I told that it has many evidences when they say observers learn equally. When you give the role to the observers, they learn equally. But it's really important for us as a facilitator to give the checklist that what they're going to observe. It's very, very important to give or hand over the checklist to this student who is playing a role of an observer. Ending up with the pre-briefing, moving further with the scenario. So scenario is again a game of 7 to 12 minutes, where we are letting the students, where we are letting the participants to encounter the situation. If you see in this picture, this is the scenario which we have run on this standardized or acting patient. They are one of the participants who have come here at NRSC during the training. So here again, we have two further procedures that we have to follow. We have two components that when you're running a scenario, they have two roles as a facilitator for yourself, as a facilitator for the participants. When you talk about facilitator, you have to be very good observer. You have to be very good listener, and you should be very good at writing. If you see, it's me standing here, taking the pen and paper to write everything. It's really, really important to write what you observe, to write what you listen, because when you sit for the debriefing, you should have some notes. Another thing, you have to be a lifesaver. Sometimes what happens, what is your objective? You know. What is your learning objective? Your students even know. But sometimes students are going haywire to the scenario. So to bringing back to the students to the track, sometimes students ask very difficult question, or sometimes students ask very not relatable, not relevant question, which is not actually required for my scenario, but you have to be the lifesaver in that. You know how to be a lifesaver and where to give the cues. Coming to objective oriented, you should be very focused. When you're running a situation, when you're running a scenario, you should know that you are going for the objective. You are focusing on the objective which I have planned. So you should know to keep the students on the track, you should be objective oriented. Sorry. For participants like who are performing the roles, you should be very keen to make sure when students are checking the scenario and when they're actually performing the skill of checking the simulation, like when they're doing the BP checking, when they're doing the sugar check, then only you're giving the reading. So you should be very observant, and you should be very attentive that now it's a time for me to give the readings. And you are already planned that how we are going to give the readings, and students are well versed with the things. Checklist for observer. So whatever the checklist we have given to the observer, it's really, really important to tell to the students that where to give the checklist, where to give the points, and what observation they have made. So we are making sure that when the students are doing the procedures, when the students are on the observing seat, so they should make the points which we have given, the relevant points which we have given, because they are again students. They are not like you. They are not teachers. They are not facilitators. So they'll be focusing on some of the points. It's a role of a facilitator that we have to make sure we are giving the scenario checklist, that this is the specific point they are going to figure out and they're going to observe. So once the scenario is over, it's the responsibility again as a facilitator to make sure that whatever the points we have given to the student as an observer to get back from the students, because students has no right to talk for the students. It's like you as a facilitator who will be talking, taking the inputs, taking the observations from the observer, and you will be taking the lead to facilitate the debriefing. So when I talk about observe, listen, and write, so it's really important. If you see these two pictures, in the first picture, the scenario is going on and we have two facilitators standing. So one is facilitator and the other one is co-facilitator. So it's really important where you take the positions. So position is like where you have to stand, where you are able to listen, where you are able to observe everything. But you are not disturbing participants who are performing. But it's really important to keep the pen and paper in your hand and write and observe accordingly. In the second picture, if you see, there is something specifically going on the newborn resuscitation. And in the newborn resuscitation, something which is we are not able to see from the far, and we have to get into that to look after what is going to happen, how they are making the seal when they're giving the bag and mask ventilation, how they are making the position of the baby. So that's really, really important, that where you position yourself so that you are not missing any of the observations, you are not missing any of the communications are happening there, and you are able to write at the end. Coming to the last component, that is debriefing. Debriefing is the heart and soul of the simulation. If you remember the previous slide where I talk about blocks, 2 blocks for the pre-briefing and this scenario are same in size. When we talk, the same time duration is happening. And if we talk about the last block, which is debriefing, it takes more of the time of the simulation. That's why we call it heart and soul of simulation, because maximum learning takes place in the debriefing. That again depends how you debrief your session. So person who is going to debrief, the person who is going to take the discussion, he should be a content resource first. Definitely he should be knowledgeable, but not forgetting he should be a debriefing expert, that what type of questions I'm going to ask. So what is debriefing? It is the post-event discussion or after-event discussion of the performances, like what has happened, and the thought processes, what was their frame of mind, so that they can reflect back to the experience they have done in the simulation scenario. So the debriefing is not about, we are talking about the performances only. It's very, very important to understand their frame of mind, because when you understand their frame of mind, they learn more. So which makes performance and thought process leads to reflective learning, right? So if you talk about the structure of debriefing, it has further 3 components, again signified with the size of blocks. The first is reaction phase, the second moving further with the analysis, the most important phase of the debriefing, and last one is summary. Again, important to understand what they have learned. If you see this picture says the double loop learning happens. If the strategies and techniques, what they have performed, so the results what we have get, it's important to understand from the results why it has happened, what it has been done. It's not about it happened, it's about why it happened. So that if we go from the results to the strategies and techniques, it's only single loop learning taking place. But from the results, if we're going back to the assumptions, then it means double loop learning takes place. Double loop learning says that we are changing their frame of mind for the next scenarios which they're going to perform, or the next practices which they're going to happen, which are going to happen in the clinical areas. So it's really, really important to know their frame of mind instead of assuming the things that they have done right or they have done wrong, right? Coming to the phases of debriefing. The phases of debriefing is in the reaction phase. If we talk about express and sequence. So if you see the slide, reaction has a bigger box than the summary, but analysis have the bigger box than the both, and which is a big difference, right? So the phases, when you talk about reactions like we are allowing them to ventilate. Let's say students have performed a scenario on cardiac arrest and they could not save the patient. So they are in that guilty. That guilty is related to, oh my God, if I'm not able to see, or if I'm not able to manage this type of patient in the clinical area, I'm not capable. So they are feeling guilty. And the other guilty is about the fear. What my teacher is thinking. She doesn't even know that how to manage the patient with the cardiac arrest. So if they are in that notion, if they are with that thoughts, definitely they will not come with you during the debriefing session. They will not understand because they have that fear and they have that anxiety or guilty in their mind. So they will not come with us. They will not mentally will be with us. They will be just physically sitting and they'll not express. So it's really important to ventilate or take their emotions, that how they are feeling, and important is like to clear, or that emotions has to be resolved and that emotion has to be clear off from the student's mind. Next is sequence. Sequence is very, very important again, because I'm on the hot seat. The person who is taking care of the inventory and the person who is just observing based on the checklist given by the teacher, they are not able to recall what has happened. So when you sit on the debriefing table, it's really, really important to make sure that some of the participants can be the hot seat participants, can be the observer, whosoever, just to take out the sequence that what has happened in one-to-one or step-to-step manner, to make everybody aware about what has happened in the scenario so that they can give their inputs when we are talking about the analysis phase, the next phase of the debriefing. So when you talk about analysis, it's not about this has been done right. It's not about this has been done wrong. It's about what has happened and why it happened. We are not talking about this is the mistake you have conducted. We are not talking about especially good performances. We are not talking about the low performances. We are making that performance of corridor, normal performance of corridor, where we are talking about what other things happened and why that happened. Whether it has happened in a very good manner, because we want to reinforce for the other students how they're going to make sure that they're going to do the same way or in better way. And if the mistakes which is not good, why it happened, again, we want them to reflect that what was the problem happened, what was the reason they could not make out. Let the students give their thought processes in that, so that we are taking care of analysis. We are just taking the initial discussions, but we are allowing them to be in the bird's nest. It's not like that facilitator is asking, one person in the hot seat is answering. We have to take the discussion for further students, that it is not making a ping pong, it is becoming a bird's nest for the students, so they are learning from each others. Coming last at the summary. Summary of everything, whatever you are doing, what you have done, it's very, very important. We have to summarize. Summary is not about the pre-briefing. Summary is not about the scenario. Just making it clear in a more focused way, summary is all about the analysis. What has happened, why has happened, and how we are going to improve next. So what is the summary is that what we have learned in the analysis phase, not in the pre-briefing and in the scenario. And when the summary is over, when effective analysis has happened, then only the take-home messages will come. It's really, really important to understand from each one of the participants to give their take-home what they have learned when they're going out of this room. So this is all about the phases of debriefing and about my presentation. So simulation is the single most important trend in nursing education today, the way to move from learning to doing. Thank you so much. Thanks for this opportunity once again. So any questions? I'm open for discussion now. You can put in the comment box and wherever you feel.
Such a detailed explanation about the process of simulation.
Thank you.
We are very grateful to you, ma'am. Thank you for sparing time from your hectic schedule, ma'am.
Thank you so much. It's again a privilege for me to talk on this platform. Thanks for the opportunity.
Thank you, ma'am. So now is the time for our last session, that is implementation of simulation in nursing curriculum. And this session will be taken by Professor Dr. Manju Bala Das. Ma'am is a very senior faculty, having a rich experience of teaching graduate and postgraduate students. Presently, ma'am is affiliated as a HOD Obstetric and Gynecological Nursing at Mother Teresa Postgraduate and Research Institute of Health Sciences, Pondicherry. About the background, ma'am has done BSc Nursing in 1990, MSc Nursing in 1999, and PhD in 2012. Ma'am has also done many certificate courses such as Basic Course on Epidemiology and Statistics in 2012, certificate course on infant and young children feeding in 2013, national trainer courses on infant and young children feeding 2016, online research methodology course 2016. Ma'am have many achievements such as ma'am has published 2 books, received special awards such as Best Educationist Award from International Institute of Education and Management 2012, Eminent Educationist Award from National International Compendium 2013, received Rajiv Gandhi Excellence Award from Solidarity Society New Delhi 2013. We are very grateful to the ma'am for sparing time. I welcome you, ma'am.
Thank you so much. Am I audible?
Yes, ma'am, you are audible.
Yeah. Okay. Can you make me able to share my screen?
Yes, ma'am.
It's so disabled. I could not share. Please make me able to share my
Yes,
screen.
ma'am. Now you are co-host now, ma'am.
No, still it's yeah, I can do. So can you see my screen here?
Yes, ma'am.
Yeah. Thank you so much. Thank you so much, your Jyoti ma'am, principal, and Ramandeep, and NSS Society, really at a large, to connecting all of us today here, and all the professionals who speakers who has really talked before me and made my part very easy. Because the first 2 speakers, whatever they told, simulation and the process, if everything is going on well, surely we can implement the simulation in the nursing curriculum. So that's what my part, implementation of the simulation in nursing curriculum. So let us discuss. Can I do full screen slideshow? Can you see the full screen now? Can you see?
Yes, ma'am.
Okay. Yes, ma'am. Yeah. So what we will discuss in this session, we will discuss today, like what is the importance of this implementation of this simulation in nursing curriculum. Why we are thinking, as like Sukhpal Kaur madam has told, today INC has implemented in the syllabus, no, the changing new syllabus semester wise. So in that there are some modules, and most of the part they have given like simulation based learning, and as madam has pointed out, it was very much useful during the COVID scenario. And all of us, we are in the government institution, we know we have the attached hospital, very good teaching hospital, where the patients, as like madam said, open book. We are getting enough patients in real area. Still then, during COVID, the restrictions made the children restricted to the lab. So that time we had this problem, like how we can make the practice of the children, because totally 2 years, the 2 batch of the students, they are not getting the clinical experience. So we need to give some real type of experience where they can learn. So thereby the simulation came, where we can think the simulation can have the real effect as like the clinical area, but already the previous speakers have explained. So now we like to say something. What is the things happening here implementation? It's like a coordination between the theory and the practice. So simulation removes the gap between the theory and practice. As like we are saying, the classroom, we are teaching the theory and we are sending the students for clinical to have the practice. So whatever we taught in the theory in the classroom, they should practice while they are going in the clinical area. So that is supposed to be. Now, during the COVID time, what happened? We could not do. We could not send the student because of the restrictions. So what we have done in the lab, we send them for practice. So simulation lab, if it is there, that maintains and that replicates the real situation like hospital. So student can learn equally and they will not miss the opportunity not to meet the patient in the hospital. But there are some difficulties in the practical situation, as like we are not coordinating the theory with the practice. And what is the difficulty? It is the lack of understanding. lack of understanding the nursing, the concept, so that the professional integration is lacking. How we can achieve that? If we apply the new technology or the innovative techniques, that is the simulation in the nursing curriculum. If we implement this simulation, the part, then we can remove the gap which is there. So also simulation in teaching learning process, we can see what it makes. Simulation already we no need to say, because many of the previous speaker, they have defined what is simulation and what it gives. It is like closely as possible like clinical area practice, which is replacing completely the real life experience and following certain scenario based learning. What is the purpose? Why we are thinking today to include the simulation in our nursing curriculum? One first important thing is to bridging the gap between the theory and practice through this simulation. Second important thing is it is the key component because nursing is the like most of it is practice oriented curriculum. Then the theory, if the skill is there in hand, the people can sign in the nursing profession. So for that purpose, for our professional upliftment or the growth in profession, we need to include the simulation in curriculum. Then also important thing like increase the student knowledge and confidence. As previous speaker is, they have shown the video. Also they have explained well. Like if you are including simulation, that gives confidence to the children, to the approaching to the real life situation. Before going to clinicals, when we train them, this is the situation they are going to face. So it will not be a reality shock for the student. That is like experiential learning through the simulation. So that is the purpose we need to include. Increase satisfaction. Another important thing is the satisfaction is high. There are some research studies also conducted in simulation based learning in the curriculum. So they have shown the satisfaction rate is high among the students if they have included in the, that means they practice in the simulation lab more before coming to the clinical area, then used for teaching the theoretically and clinical skills. So that way also it is very much important to learn the clinical skills while we are giving the theory side by side. So we need to include the simulation in curriculum. This is the thing already they have shown. So how we can like reduce the gap, or there is no, this is the theory, if you think this is the practice, so we can combine, because of this simulation we can combine this, or we can remove this gap only because of the simulation. So simulation has the important role in the curriculum, nursing curriculum, to implement in our nursing curriculum again. Now why simulation is needed, or why need to be integrated? Very important thing I have discussed also. It is a crucial point. As nursing, we know it is most of the time practical oriented, and there is a challenge situation that we are not able to send our children to clinical area. So we need to cover up this lacuna. We need to inculcate this simulation in our curriculum so that students can well trained. Importance of implementation in, again, as it is practice oriented, and the theoretical knowledge need to be increase the psychomotor skill of the children. So how the skill we can increase if we equip our children by the practice. So that can be takes place in the simulation lab before sending the children to clinical area. Also, this clinical situation scenario, so we can give more and more scenario based learning so the children can understand this type of things they will be facing once they are going to clinicals. So there is a study like the study is performed like the author Ikiria and Iverim in 2017 conducted a study among the nursing students and the faculties. What they have shown that it shows that involve a nursing student group performing a number of patient care activities on a mannequin or by a standardized patient. So they have shown that they perform less medical mistake in the clinical setting than the student who have not exposed to the simulation lab learning. So this is the study has conducted and proved how simulation is making the proficiency in the practice before reaching to the clinical area. You can see this is the simulation lab. Already Madam Anu has shown their simulation lab and how they are doing, what are the things they are doing. Even the first speaker has shown from Dubai. So it is the perfect time. All of us, we have to think how we can inculcate this simulation in our curriculum. So in order to prevent this theory practice gap, we need to frame the standard, simulation standard. Then second thing, limited clinical site. We, as I told you, we the government people, no need to think, okay, we have more number of reach of the patient and people can go directly to the hospital and get the involvement. That is true. But there are some private institutions where the direct patient involvement is not there. Their students are not getting the experience of the hospital. So in that condition, it is better the simulation lab and they can at least get the experience. So these things can be possible. Second thing, inconsistent clinical experience. See, we know though clinical area is there, sometimes we do not have adequate faculty who can go and demonstrate in the clinical area. We do not have clinical instructors who can demonstrate to the real patient. So it is better to have the clinical simulation lab always where we can demonstrate that that time even we can require recruitment of less faculty, but they can demonstrate in the lab properly in the division of the students before sending them to the clinical area. So it is the right time or the perfect time for all of us to think of the including of the simulation in our nursing curriculum. What the nursing student need at present, they require thinking like a nurse. As first speaker has shown the picture, the baby is feeding to a doll with the feeding bottle. That means they are taking the role of a mother. That is the simulation. Similarly, here the student nurse can think they are the nurse while working in the clinical area. Before getting their job, they are preparing themselves. So they should think like a nurse. Then only the real feeling will come. They should think like this patient, emergency case or trauma, head injury, how they can manage. So then only they can react to the real situation. So then the clinical judgment will come. The clinical judgment is what? An interactive process that uses the nursing knowledge to observe and assess the presenting situation. So to the real situation, the student can think and take the decision according to their judgment. So that is very much important, or that is possible only in the simulation learning. So simulation learning gives us knowledge plus critical thinking and decision making. So all the things are possible only in the simulation learning. So when the children are facing to the real life situation or in the hospital, they will commit less mistake, which is already proved in the research studies. And you can see here the standard improved standards, which is very much important for the simulation. For the implementation of simulation in curriculum, the simulation standards. So how we can do? First, the design the simulation, what we are going to do, then prepare the outcome and objective, then facilitation for that, debriefing. Already Anu Madam has told properly what is debriefing, how to do, participant evaluation, then professional integrity, which is very much important. The team approach is important in the simulation, which is needed. Simulation enhanced into professional education, then implementation or the operation. Further, why simulation works and how it works. Deliberate, the practice, and mainly it is constructive. Always, that means, as Madam said, we are not commenting the people. We are just facilitating them. So thereby they are learning. It is not criticizing what they are doing wrong. We are just strengthening their skills. We are asking them what they have done to themselves to understand and how they can improve. So that way the children are learning better. So here, experiential learning, how it is happens, like concrete experience, concentrate on their experience, reflective observation, and their active experimentation, and after conceptualization. By that, the children are learning better way. And it is a safer zone where they are, if commit mistake also, it is not harming to the patient. Nobody's life is in danger. So it is always a safe zone, the simulation part. And student faculty response. Here the faculty are the facilitator. They are not the commentator or the judge. They are the facilitator. So student approach better way in the simulation learning. And evaluation, here we can evaluate better way than in the clinical area. So simulation always gives a value. Clinical judgment also takes place in better way. So this is the framework, what we can inculcate in our nursing curriculum while we are implementing the simulation. Like here, student, teacher, and the educational practice. Education process is involving to the student, teacher, and the environment, method of teaching. So here we can see the teacher, what it makes, teacher makes description, what the student is doing, doing the program according to their level and according to their age, we are fixing the things. And the educational process together it happens, like students are the active learner and they are giving the feedback, what they have done and what they need to improve themselves, because they are seeing themselves as the everything, the simulation part is pre-recorded, and so we are playing the video, what they have done in the situation. So they are understanding in better way, and it is a collaborative learning because it is a team approach. So one member in the team is not doing also, whole process is going to wrong, that the children are understanding. So gives a team value for that. And also there is a track how to change themselves. And here the simulation design, the characteristics, what we are doing, it depends upon our objective, how we prepare, depending upon the high fidelity or low fidelity simulation mannequins, problem solving approach, student support, and debriefing. This all things is very much important for our simulation design and effectiveness. And outcome always, if it is good, naturally the outcome always will be good in simulation learning. So we are expecting the outcome like learning, better learning, skill performance will be better for the student, learner satisfaction, critical thinking is improved, and self-confidence also improved. What are the benefits of this simulation-based learning? It promotion of the critical thinking of the student. Simulation enables the student to work in the environment closely resemble to the hospital. It gains the healthcare and nursing experience even before they are starting their professional career. Students are able to put everything they have been taught into practice and cope with any difficulties or the problem, make mistake without causing damage, and all that in a safe environment without any risk whatever for the patient, which is very much important. So there are some evidence-based studies to strengthen my presentation for the implementation of this simulation in nursing curriculum. So Ingrid Tosfat in 2017 conducted study implementing the simulation in nursing education program, a case report in Tanzania. They have reported that the student in nursing education program found that simulation session is very much useful, motivating, and realistic learning method. And they have quote that our experience may provide useful insight for other nursing education programs in low-income context. It looks like a deeper knowledge about the feasibility of simulation-based education from both the teacher and student perspectives is necessary. So that's the study which has given us the way forward to implement the simulation-based learning in our nursing curriculum. But as like in every process, advantage and disadvantage is there. Here also, there are some limitations. In first speaker also told, as three things are very important. student, faculty, and environment in simulation. Similarly, we need to consider the limitations. If we consider the limitation, need to overcome to implement those things. So what are the limitations here? First thing is, it provides the opportunity for acquiring the applied knowledge and skill through use of the simulators or standardized patient in virtual setting. Whereas it is impossible to approach a patient as a whole, as a biopsychosocial human being, because we are not touching the psychological aspect in simulation learning. It is not possible. How far we are doing in real situation, high fidelity mannequin, still then the psychological part, which is really emotional bonding part, which is missing in simulation. Simulation training is that sometimes not all the variables of the emergency can be included. Why? Because it is carried out in the controlled setting where it is managed by the educator to stop or to restart. Like we are knowing like when we have gone for the training, no, our facilitators have done the same thing, like heartbeat. How much it is, we need to continue the CPR or the newborn resuscitation, or when we like to end the things, we are getting the stimulation, but it is controlled by the educator to start or restart, which is not there in the real situation. It may not be possible all the time. Simulation is a process tried to resemble to the real life, but it is not the real. It is not the real. A realism depends upon the fidelity of the simulator. So if it is high fidelity, again the realism will be more compared to the normal mannequin, which is not possible to purchase in all the institutions at a time. Not possible at all. Like we are the government institution, we are facing trouble. We all the faculty have gone to NRC and trained, because after I am the first person trained from my institution. Then I told the good of this simulation. So all the faculty are simulated. They have gone to get the training, but we are handicapped without this high fidelity mannequins in our institution. And we cannot purchase because it is a government institution not getting the fund. So this is the demerit, limitation. So this is the delimitation of, again, to apply or to implement this simulation in our curriculum. Though we want, we could not fulfill all the aspect of this simulation. Only thing is that by trial and error method, which is possible by us keeping the stations with the minimum mannequin, we are doing the things. But anyway, we should start. We should not think that these are the limitations. So we should the minimum things. Slowly we can pick up other things. How advanced the simulation model may be, will always be imperfect imitation of the human system. We cannot imitate as like human in the mannequin. Though well-trained students may be, whenever they are called for the real life situation to face to the hospital, they are stressed, they are freezed to do the procedure. Sometimes they are worried to the real situation, however the practice in the simulation lab. And another important thing is that the training of the profession in simulation process, which is the technological issue. If we do not have high fidelity mannequin, again the learning is half learned. The effectiveness of simulation scenario is possible only if high fidelity mannequins. What are the challenges and barriers we are facing regarding equipment, regarding the lab setup, the space we require, purchase of the high fidelity mannequins, familiarize with the process or the technology. Unless we are trained with handling the mannequin or the high fidelity techniques, we could not do it. Being a simulation educator is different. Being a professor, we may be professor, we may be doing PhD, but if we do not undergo the training of the simulation, we could not know the process. So it is very much, again, limitation if the faculty are not trained. However, such distinctions are really made health educators are inadequately trained, have limited skill to make it effective training, and incomplete training is another significant challenge. Incomplete training, half training or the partial training of the simulation. Again, it is difficult because we will give all the wrong concept to the children, and first impression is last long. Whatever we told in the beginning, that will fix it in the mind of the student. It will very difficult to change the mindset again. And educator and stimulation again, like here, the poor designed scenario, if we could not design our scenario properly, that gives difficulties. And another thing very much important is your communication part, which is very much important in hospital patient environment, which is not there in our simulation. See, the very important thing, in the beginning of the procedure, we are asking consent and explain the procedure to the patient. Whereas I am also experiencing in our lab, whenever you give some simulation and OSCE, the children are not explaining the procedure to the patient. They feel how to call by name. So that is the problem what we are facing in simulation lab. And educator in stimulation, depending upon the like facilitator, the simulation, effectiveness of the simulation depend upon the educator, the facilitator. If we are skilled enough, we can teach better way, we can facilitate better way than the non-educators. As I told you, though they are professors, but if they are not trained in the simulation, they cannot perform better way the simulation. So that is very important. There is a study by Sims et al., who has aimed in investigating the factors affecting for the comfort of simulation educators in Australia University, reported there are 4 factors which is important. They are becoming the barriers also, like personal barrier, structural barrier, human resource barrier. So these are the factors which is very much important. Personal barrier, including the stress from the student or what they expect, we need to understand. Structural barrier, again the material, the resources, if it is adequate only we can act. Human resource barrier, the facilitator, if they are skilled enough only, they can do the things. Another study conducted by McNeon et al., they have conducted a study and reported that availability or lack of resources which affect the ability of the educator to join in the simulation activities in all the course of studies. And here, even the same study, the students reported that the role of an educator in simulation program is very significant. So if the educator facilitator is good, naturally the simulation education is good. So it depends upon the facilitator or the educator. But we no need to think of the limitation, but we also need to think how to overcome these barriers, challenges, or the limitation. What we can do to overcome this, because this is the time we need to inculcate, we need to implement the simulation in our curriculum. So we have to think the limitation, but we have to think the ways how to overcome that limitation so that we can implement in our curriculum. So the author McLister et al. Suggested how to overcome the barriers, like providing assistance to the educator in their work. What assistance we can give? We can strengthen them. How we can strengthen them? Sending them to NRC to train. They should be trained in the simulation trainer so that we can do that. Okay, if we cannot send them, all the faculty, they may not spend much money. So what we can do? One faculty who are trained, we can ask them to train to other faculty in the same institution. At least we can stimulate them or sensitize them. What is simulation learning and how they can do the things in a better way. So we need to provide assistance to the educator. Second thing, enabling the student to have direct access to the clinical skill videos. The real life situation, some videos we can collect, the same scenario we can create in the simulation lab so that we can avoid these limitations. Focusing on teaching the clinical skill, more of the clinical skill need to be focused. utilizing the team in the documentation of the skill learning, learning communication skill in an entertaining and imaginative way. We must also teach the children like I am a patient, talk to me. So that is the way how we can also encourage the communication process. So the children can learn how to communicate in the real life situation, improving the time management and prioritization of the need for the student, because time management is very much important. And as the simulation learning is required small group, so the time management is very much important, where as the first speaker has pointed out, when there is 100 numbers of students in the class, just imagine how much time we need to spend, how much time we need to repeat the same scenario again and again to make education to the children in a proper way. So sometimes in the beginning we will do it in a proper way, while going in the end we may not do, because we are acquainted to the things and we may not sensitize ourselves as like we have done in the first time. So time management is very much important, and also need to think, though we are repeating the scenario, but the educators who are coming first time, they are new to the scenario. So we need to make them in the same way what we have done in the first time. So we need to have a checklist for ourselves also, the educators, how we are performing each time, what we are lacking in each time. So then we need to standardize our process to have the same way to all the people. Then more training in simulation related issues need to be conducted, carrying out the rehearsal and creation of the backup copies. Before teaching to the children, all the teachers, educators, facilitator must rehearsal themselves, so that they will not commit mistake in front of the children. So that will break the confidence of the children. And always we should have the camera, so there will be backup things. We need to see ourselves where we are committing mistake, so that we need to strengthen ourselves also. So these are the things how we can overcome the barriers. So what are the main components needed for the implementation of simulation in our curriculum? Very important thing is faculty. Very important thing is faculty. Space, adequate space must be there. Student and faculty must be trained. And there must be audience to whom we like to do. And also this faculty, either part-time faculty. If we do not get all full-time faculty, at least we can keep part-time faculty with us. And very important, last but not the least, but it is fast funding. If funding is there, economical support is there, we can get everything, and we can also things properly. What is the future of simulation in nursing education? Nursing science is art and science, and highly significant and integral part of all healthcare system. Nurses and their training are fundamental elements of effectiveness of the system. Therefore, special attention to be paid, must be paid. Any change in the training of nurses are interwoven with the technological advance, and their training is directly affected by any technological means available for teaching. The use of simulation as an education strategy represents a great challenge for the nursing education. Simulation may improve healthcare and patient safety. No patient who is alive is put at risk at the expense of the trainee. So simulation is important. Simulation provides standardization of the cases, promote the critical thinking, allows the supervision of patient care, provides immediate feedback, and help the students to assimilate the knowledge and the experience. It is an ideal composition learning experience. Probably the greatest change in nursing education is the introduction of the virtual simulation. Continuation and development of the virtual simulation constitute a focal point. Constitute the focal point. Sorry, just the slide is gone. So it is this like virtual learning, virtual simulation, or today we are having this thing, no, like artificial intelligence. That type of simulation we can inculcate. So that is the future, what we are expecting in our nursing curriculum. So virtual simulation must become a part of overall simulation program. Despite the fact of virtual and augmented reality, they are quietly early in the stage, and opinion will be rapidly spread as much as simulation related technology become available and affordable. And quality simulation is very much important always for all of us. So by that way, we can implement. This is the time where we, all of us, educators, we need to skill enough ourselves to learn how we can implement this simulation in our nursing education. So we can strengthen our education. Simultaneously, we can strengthen our students too. Thank you so much for giving me this opportunity. Thank you. Thank you once again for the organizers, Ramandeep, Cutie Sweetie Beauty. Thank you.
Thank you so much, Manju ma'am. You have explained in detail about implementation of the simulation in the nursing curriculum. Thank you so much, ma'am.
Any doubt, any clarification?
Now it's time for post-test. Participant having any doubt? I guess no doubt here, ma'am. Thank you, Manju ma'am.
Thank you, dear.
Now it's time for post-test. We are sharing the post-test link with you in the chat box.
Thank you so much, ma'am, for taking such a detailed session. And I think all the participants and everybody has got the zest that how are we going to implement the simulation in our nursing curriculum. As previous speakers also said that it is already done by a major of the faculty, but how we do it in a standardized manner, this is what our speakers have done.
Yeah, thank you. Thank you for this opportunity, NSS.
Thank you, ma'am. Pleasure, ma'am, to connect with you. Without taking much of the time, I would request any of the participants to share their feedback if you have any. I'm sharing the post-test link. You will be able to do it by the when we are doing it. Priya Sharma has raised her hand. Please allow her to unmute. I've shared the link of poster. By the time we are having the feedback, you can go ahead with the poster. Yes, Sridevi ma'am, please go ahead and you can unmute yourself. I have received 13 responses and we are waiting for all of you to respond. And then we have just quick session of like saying thank you. And then we can discuss. I know we are late for 30 minutes. By the time we all are performing the posters, I request any of the participants would like to give us the feedback so that we can improve in the part of when we are organizing our workshop. I hope all of you have got the understanding how simulation works, and I can see majority of the participants are nursing faculty only. And this theory part, how are we going to implement in our teaching, that we will learn in our upcoming workshop. And then early bird attraction, we have kept that those who will be registering as an early bird will get a Chandigarh tourism package free. That is a one-day whole package for getting the sightseeing for Chandigarh. The details will be shared soon. As soon as we finish up, then you will receive an email having your certificate and details about the upcoming workshop. Can we have the feedback from anyone?
Good afternoon, ma'am. Good afternoon, everyone. Ma'am, it was a very
yes, ma'am.
Yes, ma'am, it was a well-planned workshop, and I'm very eager to attend the workshop, which will be happening in a physical mode. And about simulation, ma'am, nowadays, even after COVID, simulation is one of the biggest and very helping modalities for the teachers as well as for the students, because there are lots of things which we are not able to perform practically in live situations, which we can do in simulation labs. So this conference was very helpful, and I'm thankful to Nursing Scholars Society and College of Nursing GMCH for allowing us to participate in this conference, and looking forward for the workshop, which is on physical mode. Thank you, ma'am.
Thank you so much, ma'am. Thank you. We have received 23 of the post-test responses. We are looking forward so that all of you can participate. The post-test, the link will be open for another 15 minutes, and you can complete the post-test. Anybody would like to give any feedback? Otherwise, I'd like to propose the vote. Okay. I must start with the thank you for our chief guest of honor, Dr. Jyoti Sareen, Dean of Nursing Sciences in MMD University. And I'm extending my thank you to Dr. Supal for in absentia and speakers who have taken out time to prepare for this webinar and deliver the lecture as well. And I must thank the participants who have spared time and have been patient with us. Even with the technical hitches, they were continuously with us. Thank you so much, everyone. And the most important thank you is for the Nursing Scholar Society. I can see the Nursing Scholar Society members also in our participants. I must thank you, Professor Binny Joy, who gave us the opportunity to use the platform and conduct this webinar. Looking forward for your participation in the workshop. Thank you so much. And the link is again open for another 15 minutes. Please complete the post. And you will receive the certificates via email. So make sure when you're writing your email, it is rightly written. As I have observed that when we were sending the details of the today's meeting, few of the email IDs were wrong. So I request you to please check again that your email ID is correctly spelled out in the form. Thank you so much for being with us. So here we come to the end. Thank you.
ये क्या आ रहा है? Madam, can we leave?